A recent warning from health experts underscores the importance of understanding the causes of bleeding after sex, a concern that can understandably provoke anxiety. Dr. Ian Curry, a consultant gynecologist, emphasizes that while there are various reasons for this symptom, it is crucial to seek medical advice if the bleeding is recurrent or causes significant concern. He advises individuals to consult their GP or sexual health clinic if they experience persistent bleeding. Dr. Ann Henderson, a consultant gynecologist, offers insight into how the color and amount of bleeding can provide clues about its origin. Bright red bleeding, which appears immediately after intercourse, is often associated with issues related to the cervix. This type of bleeding is usually temporary and may last only a few hours. On the other hand, bleeding that continues for up to 12 to 24 hours or has a brownish color is more likely related to the womb lining. Several conditions could cause bleeding after sex. An undiagnosed STI, sexually transmitted infection, is a potential cause, as bleeding can be a symptom of such infections. Fortunately, most STIs are treatable with proper medical care. If an STI is suspected, it is advisable to visit a GP or a sexual health clinic for diagnosis and treatment. Another possible cause is the presence of polyps on the cervix. Although the term might sound alarming, cervical polyps are rarely cancerous and can be removed through a minor surgical procedure if they cause discomfort. Insufficient lubrication during sex can also lead to bleeding due to friction and dryness. This issue might be related to menopause or insufficient arousal. Using additional lubrication can alleviate discomfort and prevent bleeding caused by dryness. Infections such as pelvic inflammatory disease, PID, can also cause bleeding. While PID and other infections are typically treatable with antibiotics, if left untreated, they can lead to more serious health issues, including fertility problems. An ectropion, which is more common in younger women, might be another cause. It occurs when the area of fine blood vessels at the cervix's entrance becomes agitated. Over time, this area of cells moves within the cervix, reducing the incidence of bleeding. Endometriosis, a condition where tissue similar to the uterine lining grows outside the uterus, can cause bleeding if it affects the cervix or vagina. Women on the contraceptive pill might experience breakthrough bleeding, which can occur during or after intercourse. This is generally not a cause for concern but should be discussed with a healthcare provider if it becomes frequent. Postpartum bleeding during sex is also a normal occurrence due to hormonal changes following childbirth. The hormonal fluctuations during pregnancy cause the cervical canal lining to protrude onto the cervix, which can lead to bleeding. Separately, Dr. Claire Merrifield addresses derogatory terms related to breast appearance, such as burger nipples, which refer to a larger, darker areola. Merrifield emphasizes that such terms are harmful and unnecessary, as they perpetuate body shaming and can negatively impact self-esteem. She stresses that nipple and areola size and color vary greatly among individuals and can change throughout life, including during pregnancy. Merrifield encourages a more respectful and positive attitude towards body variations, advocating for individuals to seek support from trusted sources or consult their GP if they have concerns about their body.